right. Hey, everybody. It's Patty with the Breastfeeding Shop, and we've got Ashley with Motif Medical. She's an IBCLC. Ashley's got a really solid background, and you've been doing it for quite a while, right?
Mm-hmm.
So, and you used to do your own groups. You were just telling me a little bit about that. How did that take place? What was that?
That's actually the first thing that I started doing when I decided to work for myself, was just to organize support groups. And we'd meet, once a month. We used to have this wonderful store called Bohemian Baby, and they had this lovely little classroom type set up in the back of their store. And we'd meet there monthly. We'd sometimes have refreshments and things like that. And sometimes we'd have a topic of discussion or a theme. Maybe introducing solids, or how to breastfeed and travel during the holidays, whatever was relevant at that time. And then some days we just had, open form discussions. Bring your questions, bring whatever you want to talk about, bring your stories. Sometimes it literally was just, let's just share what we're going through right now and laugh or commiserate or whatever the thing was that day for the moms. And a lot of friendships blossomed out of that. Even for myself, there's still moms that they've weaned already. They're on to second and third births by now, and we still keep in touch like old friends. So this is such a meaningful type setup, and to be able to do it virtually, I think is maybe not as good as the real deal, but
Yeah.
pretty dang close. I think it's important to be able to reach out to moms like this.
Yeah, I agree. We used to have something like that. We're in Emmaus, Pennsylvania, near Allentown, not real far from New Jersey, but we used to have milk and breastfeeding. I forget what the name of it was, but it was a group, and the lady that ran it, she was so smart. She's a nurse practitioner, but she moved away, so it stopped. And so maybe this is just so nice to be able to do this virtually too. So anyway, I keep looking at my phone because I don't know how to stream the questions from Facebook on to Zoom, and I was trying to look it up before. Do you know how to do that? I have no idea how to do that, but I don't think you can.
It's new for me too. It's new for a lot of us.
Well, anybody, feel free to ask your questions. I am looking at my Facebook on my phone. Share this with friends. We're really trying to get this going for every Wednesday afternoon. We might, if you have suggestions as to different times that might be better, but the Breastfeeding Shop and Motif Medical have customers all over the world. So feel free to leave us your feedback with the time slots and questions and so on and so forth. But maybe what we'll start out with is, we work a lot with the military and TRICARE moms, and every insurance policy has a different rules for what they cover, right? Most of them do cover breast pumps, but in particular, TRICARE does cover additional accessories if needed. Of course, they after the birth event, so you can get your breast pump, and you can get some bags at the 27-week of pregnancy marker. And then you can also get more accessories like flanges, tubing, bottles, caps, locking rings, valves, which is great because that's really what keeps your breast pump clean. But what I love is that they will pay for additional flanges, and there's different thoughts out there as to when you should measure for your flange, because a lot of times the moms want to measure beforehand, but a lot changes as they start nursing and start that whole journey. So I'm hesitant to use their insurance benefit before the birth event unless they really know. So what are your thoughts on that?
I think the beauty of a lot of these pumps, being able to get them prior to the birth, but still later in the pregnancy, they're going to come with flanges anyway. So go ahead and take a look at them when you get your box, open it up, get familiar with it. What else are you going to do right now? But check it out. You are probably going to have had some kind of size change by now if you're 27 weeks plus along your pregnancy. And this is going to kind of give you an idea of where you're going to be a few months down the road while breastfeeding, once you've had baby. Some swelling is going to occur either right before, during, or right after birth, depending if you're getting any kind of fluids during the labor and delivery aspect. If you're retaining fluid anyway, maybe you have preeclampsia. Just taking a look at yourself as an individual and seeing kind of what your water retention's even like. This is going to affect not only the size of the breast tissue, but maybe the size of the nipple too, making it bigger. But it shouldn't be too terribly different in sizing. So I think measuring when you're far enough along in your pregnancy is totally fine to do. And then maybe waiting until after you have started breastfeeding, you may not even need a pump right away. You may not even need that option right away. If you're breastfeeding for the first month or so and don't need that particular option right away, maybe wait a couple months down the road when you actually need to start pumping more regularly. Maybe you're going back to work or something, and then maybe utilize that insurance aspect if you need a different size. And there may be an option too to get maybe reimbursement. Maybe you got the wrong size and can return it or something. Just depends on the individual situation, I think.
Okay. So kind of on the same page there. Yeah. I never want to utilize the benefit and then have it not available for when, oh no, I need size 21 millimeter flange. So,
right.
And all these breast pumps, they all have different size flanges. They go by millimeters in difference. So what are your thoughts on, we do have a question, but I want to ask this really quickly. What are your thoughts on if somebody measures at a 17, is a 20 millimeter flange going to work? Because it's such a small difference. Like, what are your thoughts?
That might still be enough of a difference to maybe cause some issues. You might want to be careful, maybe using too strong a setting on your pump, for instance. You may be sucking in too much tissue if it is a little bit too big. And some brands don't even carry a 17. They don't carry anything below a 20 in some brands. So there's different products out there. I want to say it's Pumping Pals or something like that, some kind of cushiony silicone that can go into the flange and kind of make up that gap difference if there is a slight, maybe a half size. We're not perfect millimeter sizes anyway, so this is all kind of use your best possible fit. But if you're in between sizes or maybe you're still too small for the smallest option, there's some inserts that you can get to kind of fill in that gap. And then I don't think the insurance will cover that, but they tend to be pretty accessible.
Pump and Pals carry those sometimes. Yeah. Anything else other than Pump and Pals? Because they're angled quite a bit.
I feel like there's one other brand and I can't think of it right now, and I can totally look that up. Maymom, yes.
Yeah. And we do carry those. We do carry those, and they make a really big variety of sizes, which is nice.
Yes.
So,
yes. We can put those in the comments.
Yeah. Okay, great.
Ability.
Hi, I'm a new mommy and my baby is 3 months old tomorrow. Yay, that's great. Congratulations. I am EP since 3 weeks. I had terrible mastitis in both boobs and my baby wouldn't latch. We are now trying to re-latch her as I don't want to EP anymore. My baby seems to scream when I go to latch her and she fights it before we even try. Why does she do that? Any advice, tips on how to get her to latch? Also, I have a very heavy letdown, so I have to pump and hand express before latching. Any tips for that? Thanks in advance.
Yeah. Gosh, I have had this story so many times, and it's so unfortunate because I know that mom is struggling and she is probably dealing with a level of anxiety too when it comes trying to latch baby on. I would be interested in exploring when if you're able to see a lactation consultant in person, being able to do an oral assessment on that baby, and being able to check that baby's mouth and checking for things like lip and tongue tie, or even just checking positioning. Maybe we've gone so long now that baby hasn't had a chance to practice and really doesn't know what to do at this point, 3 months down the road. But it doesn't mean it can't be done. It's going to take some work. We might have to use some tools. An EP, for anybody who's watching who doesn't understand what that might mean, she's exclusively pumping up to this point. So if you're having a heavy letdown, that can also mean too that baby was unable. This is very common in babies who aren't able to latch well and maybe can't control that flow. And so your body is just kind of overcompensating right now. And I think to continue doing that, what you're doing about pumping first to get over that initial letdown response, that heavier, faster flow, and then try to get baby to latch on is still a great step. But in order to get baby to learn how to stay latched on, we need to eliminate the possibility of tongue tie and then teach baby how to nurse properly. And that might be utilizing what we call it's kind of like a feeding tube, but it goes on the edge of the nipple, and
right.
And baby latches on, and we slowly feed milk so that we initiate some drinking and slowly slip that tube out. So it's a feeding system that you can get. I know different brands can carry that. You can use a syringe in a feeding tube. There's different ways around that, but you're going to need a couple extra hands to help you with that. So it's not the most feasible most feasible tool in the world. Some other things you can try, maybe a C-shape hold, a sandwich hold on the breast, and make sure the nipple is pointing up towards the palate. Make sure the arms are out and away. Maybe hugging the breast, hugging mom instead of maybe being in front of them. That's going to create space. We want to get baby's mouth as close as possible to the breast. And we want to make sure they have plenty of mobility. So make sure we're not pushing the head. It's just supporting the neck. And as far as placement goes or aiming, we talk about using nose to nip, not putting the nipple right at the baby's mouth, but maybe closer to the nose so that the baby can have room to look up before latching on. So there's a lot of moving parts in this, and I highly recommend you follow up with someone that can help you through this, because 3 months down the road, you have your work cut out for you. But I applaud you for keeping up with this for so long. Exclusive pumping is no joke. That is a full-time job.
I know. Gosh, that is, it takes a lot of dedication. So that's wonderful. Yeah. Let me see what else we have here. My baby is 9 weeks old, and I'm still experiencing nipple pain when the baby latches. No tongue or lip ties. It is mainly at the initial latch and then goes away. My nipples still hurt at the touch of and in the shower. I really thought by now it would have been pain-free. No more cracks or sores for over a month. And an LC has helped the baby latch and said it's good. So what are your thoughts on it still kind of being, I think that's fairly normal, that it still does tend to get a little bit of uncomfortable.
Yeah, damage. Mm-hmm. Yeah, and depending maybe, how did she say how old the baby was?
9 weeks.
9 weeks. So it could be maybe a learned habit. Maybe there was a subtle restriction going on, or depending on even how the baby's born sometimes, or how they were in the womb can affect how they nurse. And I mean, there's a lot of moving parts. I try really hard not to ramble through them, but there's not a one size fits all answer for that. There's different variables that can be why they're still nursing uncomfortably like that, at least for the initial latch. The initial latch is a chomping type fashion, maybe pre-stimulating the nipple ahead of time for babies so that they're not having to work so hard to stimulate the letdown, and they can kind of segue right into feeding. And kind of removing that step for a little bit until they get better at it. You may check with maybe like a speech and language pathologist. I know that's odd, but we have one that works with babies here. And I send any baby that's had lip or tongue tie, any baby that's had any kind of odd tongue function problems, feeding mechanism problems, things like that. If they were born breech or via C-section, sometimes there's some muscle tension going on in the neck. If they weren't able to go through the birth canal or go through the birth canal the correct way, maybe body work can help with that, because we overcompensate with other muscles if we're tight in other muscles that we're supposed to be using. And so what I see, whether it's tongue tie, lip tie, breech birth, C-section birth, what have you, whatever causes some kind of kink in the neck, body work such as chiropractic work, or even craniosacral therapy, it's a nerve therapy, can help relieve any residual tension that's going to be held in the neck and jawline, and that's going to imitate what a tongue tie will do sometimes. Sometimes we're like, well, there's no tongue tie here. Why are we still getting some similar type symptoms and similar type feeding mechanisms going on? And sometimes it's just them needing an adjustment. They're tight, they're sore, and they're learning a bad habit on how to feed properly.
Sometimes they're just grumpy, for babies, they just get grumpy too sometimes.
Yeah, definitely.
When I have 2 boys, they're 13 and 10 now. And when the 2 of them nursed completely differently. My older one, he would just fall asleep and it would go on for hours and he was just sleep eating. I don't know what was going on. But my other one, he was quick and to the point. And when he was getting ready to eat more, but my body was adjusting, sometimes he would be feeding, but then it would come out too fast and it would be all over his face. And then he would get upset. So I think sometimes I was maybe overthinking it, but if I just looked at I wouldn't want milk all over my face, I would probably be upset too. Right. So you kind of adjust and, sometimes I think we need to overthink some things, but also sometimes I think we don't, if that makes sense.
Absolutely. Yeah. So assess what's going on, look at your baby. Your baby can tell you a lot of things. If your baby looks kinked up and uncomfortable, they're probably uncomfortable. I know they're a bag of mush, but they have, feelings too, and they could be just very uncomfortable in their body, and that will manifest in how they eat sometimes and cause you pain. So just take a second and look at your baby and look at you, adjust positioning if you have to, find something that works for you as an individual.
Let's see what else we have here. My baby is 8 weeks old. I have nipple blanching. Any advice to help this out until the baby is evaluated for tongue and lip ties?
Okay.
What the nipple blanching is, in case anybody doesn't know.
Yeah. Nipple blanching can look like a couple different things. It may be associated with also a misshape. We're maybe going from a rounded nipple to maybe a lipstick shape, or something with a seam where there's some pinching going on. But blood flow has left the area when we have blanching, which means there's been some hard compression going on. And this can be from that chomping kind of feeding mechanism that baby will sometimes do. Maybe it's getting not deep enough and getting stuck along what I call the ridge of doom, which is the gum line, and just getting chomped to death there. They can do some, real damage. But that blanching is not fun. It is very painful sometimes. The best thing you can do, I think, is maybe apply heat after the feeding, get some blood flow back to the area, and take care of those nipples, moms. We have to start being more attentive to ourselves too, fix the issue at hand, but also take care of your breast tissue and nipple tissue in the meantime too. Anytime you have blanching, anytime you have a shallow latch, anytime you have misshaped nipples, things like that, there's going to be at least microscopic damage to that nipple. And so we want to take some time to moisturize and create a space where fungus will not grow, where bacterial infection will not grow, basically. So something like coconut oil or a nice nipple balm, something that has an antifungal property, and make sure we're massaging that into the nipple area, maybe on into the breast tissue area, until you can get your latch evaluated by a professional.
What about using your own breast milk to rub into your?
Yes.
What do you think
that
of
stuff
it?
goes with you everywhere. It's if you can express some, rub it in like lotion, and let yourself air dry. Breast milk is definitely an antifungal and anti-microbe. Wonderful stuff.
Yeah. I have to tell a quick story before I ask this other question. This is just so funny, and I will never forget in all my years of owning the breastfeeding shop. A mom came in and she was producing so much milk, she started cooking with it. And she did not tell her husband. She was making baked goods, and he was eating it. And she told him, and he almost fainted. I couldn't believe it. I'm like, I don't
Isn't that wild?
Yeah.
And even as a lactation consultant too, like I catch myself, how would I react if I found out that's, but it's so strange. Like, we don't give it a second thought that we're drinking, cow's milk, meant for a baby cow. It's the same.
I know. It's better. It's better for humans.
Yeah, it's actually meant for humans. Why do we freak out?
Yeah, I don't understand. But it was just, his reaction was hilarious.
That is hilarious.
So my 5-week-old son was eating every 2.5 to 3 hours. But in the last 3 days, he has been wanting to eat every 1 to 1.5 hours. Should I be worried that my supply is not enough, so baby is perpetually hungry, or could this be a growth and naturally increasing mom's supply?
Definitely the latter. That is usually an indication. As long as we're having plenty of output, count those diapers. We have plenty of wet and dirty diapers. If the answer is yes, then it's his or her way of telling you, okay, mom, I'm placing in a bigger order because I'm about to hit a growth spurt. So he's increasing demand and basically getting your inventory ready to supply that demand. So most cases, that is simply just a cluster feed that is indicating some kind of developmental leap, whether it be growth or mental or, whatever, both in some cases.
How often do those happen? Intervals?
Every couple months.
Every couple months.
Every couple months or so. Everybody's different. There are a couple apps out there too. I can post them in the comments below. But there are different ways to keep track of kind of when to estimate when the next one will be. The first one usually happens around 2 or 3 weeks of age. well, I'll back up even further. There's a cluster feeding day, usually by day 2 or 3, where baby just has realized, oh crap, I've been born. What just happened? I just want to nurse. But then the first real cluster feeding session, where it's lasting a few days, usually happens between 2 to 3 weeks of age. And that's for a full-term baby. It might be a little bit adjusted if they're early. Usually around 4 to 5 months, there's another one, but it can happen periodically throughout that first full year. And it's usually followed by some kind of developmental leap, usually right afterward. Maybe they're making better eye contact with you, or maybe following you a little bit better with their eyes, or maybe they're learning something else, or about to grow a whole bunch on you. They grow more than they ever will in that first year. I think a lot of people forget that, they more than your entire life, they will grow in those first 6 months, in that first full year. So it's their way of saying, make more milk, mama.
Yeah. Yeah, that's amazing. I'm trying to figure out, I'm going to look here to see if there's any other questions. This is a good session. Let me see.
I'm loving these questions this week.
I know. They're so much fun. And it's nice to be able to help everyone. I mean, I don't know about you, not to change the topic, but I'm just ready for something to change. I want to go out and eat at a restaurant. I just want to get back a little to normal here. But, doing these Facebook Live things, it's just, it makes us feel all a little bit more normal, I think.
Right. Make me feel useful, please.
Yeah. Yes, useful, right? Is that a mom thing? Is that a female thing? I always want to feel like I'm helping somebody.
Yes.
That's like I thrive on that. We got a lot of questions. Let's see. First time mom here, and due to baby not latching, I decided to pump for her, but now my nipples hurt, look purple, and have a sore on them. How do I fix this? Is it not permanent? Is it permanent?
I would hope that it's not permanent at this point. Bless your soul, though. That's such a Southern saying. I'm from Tennessee, if you haven't figured that out yet. I know that hurts. I'm so sorry to hear that. That sounds to me like it's either a couple things, one or two things. The flange is too small or too big, and we're either sucking in too much tissue, and there's some kind of rubbing going on. If there's a blister on the nipple itself, then that tells me it's probably on the too small side. And you might also want to be double checking the strength. I think sometimes we want to hurry and get it done, or, like we said, either last week or the week before, if I crank this up full strength, I'll get more milk. Doesn't work that way. You want to simulate the way a baby would drink, and they are not a vacuum. They form a vacuum type seal when they're nursing from you, but they are not sucking with force. And sometimes when we turn up a hospital grade pump, which a lot of these pumps are now, it is too strong, and that can cause damage to them and too much compression, and it can actually be counterproductive. You won't get as much milk out because there's too much blood flow to that area, blocking the milk from being able to escape. So the first two things I would check would be the size, making sure it's not too small. Get the next size up. We know insurance can help you with that most likely. And then double check that strength. Go down a few notches if you need to.
Mm-hmm. Yeah, that's great.
Care of those nipples.
Yeah, you need them for a long time.
Yes, moisturize.
Yes. My pediatrician told me at my son's 2-month appointment that he technically didn't have any nights feeding, and I can try soothing him back to sleep instead of feeding him. I don't know, how do I feel about that? Any advice?
Trust your mom gut on that one. I think we're coming from a place of the bottle feeding culture, and you can't really rely on a bottle to soothe because you can overfeed, and plus there's a lot of air in there. But there's nothing wrong with nursing back to sleep. It's how we're biologically made to do. It's protecting your milk supply at nighttime. I think too many of us are pressured into thinking that we need to sleep train and get our baby to sleep through the night without having to drink milk from us. And that's going to be problematic on a couple of areas there. You're subjecting your supply to not making enough. There's not enough milk removal going on. And because it is just sitting there, you're potentially setting yourself up for clogged ducts and things like that. But I think there is a cultural fear of maybe creating a bad habit. And that part of their pituitary gland of creating a cause and effect is not even developed yet. So there are no bad habits being created from that perspective. So I think listen to your mom gut. There's nothing wrong. If you feel like you want to feed your baby back to sleep, go for it.
I did that all the time. it was all the time. Just, yeah.
It works.
It works. It works. Exactly. Let's see. First time mom here, and due to baby not latching, I decided to pump for her, but now my nipples hurt. Oh, wait. No, I already answered that. Sorry. My baby breastfeeds great all day long, but sometimes at nighttime during the nighttime feeds, he gets fussy. Is it normal? And just due to the fact that he has been eating all day and the flow is slower, I can see plenty of milk coming out.
Yeah, fussy babies are very normal to that extent. I think that's a common question, especially for about the first 4 months or so. They're just fussy little bags of mush. They get tired, they grow a lot. And something else to think about too, and I'm kind of seeing this in my daughter right now. She's 4, and she can actually verbalize when she doesn't feel good or when something's hurting. And I remember going through growth spurts. I know she's going through growth spurts, and how I know is she's coming to me saying, "Mommy, my legs hurt. Will you rub my legs for me?" Babies can't do that. And you think about, we go back to how much they grow in a year, they're supposed to double their weight in 6 months and triple their weight by a year. That's more than they will ever do the rest of their entire life, unless they make really bad feeding choices down the road. But you will never just double your weight in a year like that ever again. So that's a lot of growing, and it's not just muscle and fat, it's bone growth. So I think during the nighttime fussiness, I think there's a little bit of that going on too. And that's just mom tuition. That's not a doctor's, perspective or anything, but I think that's just a human tuition type thing going on. I think there's a little bit of discomfort going on. It's the same story with so many, that witching hour, that 10 p.m. feeding, that 3 p.m. feeding, or 3 a.m. feeding. My baby's so fussy. And I know there's plenty of milk. I know they're growing, but gosh, they're so fussy. But then they're okay the next day. I think there's something to it. Mom
tuition. I like that. I'm going to start using that. Let's see. We're getting a lot of questions. So can I keep going? Is that okay?
Yeah, absolutely.
My baby is 4 days old and has some jaundice and was C-section at birth. Obviously, she was under, I didn't mean obviously to the question. I added some words. She was under the light for a while at, I lost my spot, at the hospital. And I introduced a bottle to, we keep getting questions, so I keep losing my spot. She was under the light for a while at the hospital, and I introduced a bottle to supplement. Right now, she is getting better at latching, eating, but only really has a few good feedings. Other feedings, she just falls asleep, and I will try to wake her up. Doctors want her feeding every 2 hours, but she doesn't want to. Any advice? I don't want to give her a bottle again and have her get used to it.
I think at this point you might have to ask yourself, how well is she feeding when she is able to be woken up for that feeding? And it's not an impossibility to get back to the breast if she's already been introduced to the breast. So I think weigh your pros and cons in this situation and continue providing her expressed milk, because you're going to save energy that she is trying to spend trying to eat. And right now it's crucial. If she is still jaundiced, if she's still trying to overcome that, a lot of times those jaundice levels will peak and get worse before they get better. And spending energy trying to eat will worsen that and make things harder on her. So I think you might get back on track a lot quicker if you maybe spend another day or so providing her expressed milk, be that breast milk and or formula, whatever you have on hand. Now, if she's awake and alert and you want to try to feed her, by all means, this is not an every feeding type situation necessarily, but use your best judgment in this particular case. You're not going to, create something that you can't undo by providing her some bottles right now, or even syringes. A lot of my clients will syringe feed so that paced feeding is initiated, so that we're not getting used to a faster flow that sometimes a bottle will create and then cause impatience when trying to get back to the breast. But do what works for you. Let's get that baby healthy first, because if she's already been introduced to the breast, there's no reason why she can't make it back.
Yeah, that's good. That's great. A lot of moms get worried about that, but yeah, I know it's possible. So let's see. I am 3 months old. I am 3 months into my pumping journey. I have seen an LC several times to test my flange size. I pump with suction 6 to 7 out of 12, which does not hurt. For the past month or so, my breast tissue outside the flange range is red and appears bruised. It is not painful or hard. What does this cause?
Oh,
Let's see, 6 to 7, which is not does my flange try to pump the suction for the past month or so. My breast tissue outside the flange is red and appears bruised.
That's interesting. It sounds like compression type problems. It may be that maybe you're slightly in between sizes and may need an insert. You may try a lubricant of some sort so that your skin is not rubbing up against the flange. Something like coconut oil around, maybe not on the nipple, but around the nipple, around the areola, and even up into the breast tissue, so that there's some slickness to it, so it doesn't get rubbing up and down within the flange funnel, if you will. That would be my first thing to check, especially if you've already been sized by a flange expert, somebody who knows what they're doing. Hopefully.
Yeah. Keep us posted to the
that's interesting.
That question. Send me maybe a direct message. Can go into that a little bit further for you. My baby, 1 week old, eats every 2 hours. When would you recommend start pumping? And when during the day is the best time to pump? How many times a day would you recommend to pump? It's always a good one. Important one too.
That is. And I love when that question gets asked. That is an individual question, however. So let's just talk about if you're not having to go to work and you're home with your baby all the time, you're going to be a stay-at-home mom and you're just wanting some extra milk on hand, pump when you need that extra milk, maybe a day in advance so that you know what you need. Maybe when this quarantine stuff is lifted and you want to go out for a girls' night or something and you just need a couple ounces, pump for that cause. You don't have to start worrying about stashing now. If you are planning on going back to work, however, that depends on when you're going back to work. If you're going back to work, just a few weeks after giving birth, then you want to start pumping first thing in the morning. First thing in the morning is when we make the most voluminous milk, the most milk to be able to be stored pretty regularly with a pump, or expressed, I should say, not stored, expressed pretty regularly with a pump. It gets thicker as the day progresses, and a lot of times we will notice a lot more volume to work with first thing. You want to go ahead and start saving now, but if you have 3 or 4 months of maternity leave, wait and enjoy your time off first and foremost. Give yourself that time to relax and enjoy your baby. If your baby's only a couple weeks old and you don't have to go to work until 12 or 18 weeks postpartum, take this time to just relax with your baby. About 2 to 3 weeks before you go back to work, start pumping once, twice a day, first thing in the morning. Start saving a little bit. And you don't need a freezer stash. I highly, highly recommend you not going on places like Pinterest and things like that for breast milk storage recommendations, because they're daunting and unrealistic, and they all get donated anyway because no one can use it in the amount of time that they need it for. You don't need a freezer stash. You don't need this huge, huge deep freezer full of. If you're able to breastfeed at the breast and you're not having to exclusively pump, you're just needing it for work or whatever, you don't need that much. On average, a baby will drink about 1 ounce to 1.5 ounces, especially as they get older, per hour. So if you are working, say, an 8-hour day and you have a 30-minute commute there and a 30-minute commute back, that's 9 hours that you're away from your baby. So for every hour that you're away from baby, save 1 ounce to 1.5 ounces. So for a 9-hour day, that's including commute and work day, I would save 10 to 12 ounces or so. And that's not a lot. That's just a little, if you're looking at a full size bottle, that's just a little over one of those.
Right. I have all these bottles next to me. I was going to grab one.
Oh,
to get a visual. Yeah.
Maybe have a visual.
Yeah.
It's not a lot, and it keeps very well. It does not go bad, especially if you handle it with care. Freezes nicely, refrigerates nicely. You don't need a whole bunch, so don't overwhelm yourself. I love that question. I love, how can I plan this and it not overwhelm me and me totally just give myself a huge headache over it?
I have a question for you. The milk consistency changes throughout the day.
Uh-oh, you froze on me. Say that one more time.
A lot of so the consistency of your milk changes throughout the day.
Yes.
So if you're pumping, is it a good idea to write the time on the bag that it was pumped? And would that be should you, I don't want to make anybody crazy because it's breast milk, like you're doing something amazing for your babies, but should you be feeding, if you're away tomorrow, right? Should you be feeding what you pumped at 9 a.m.? Keep it consistent with when the milk was, does that make sense?
Yes, I understand what you're asking. I think during the day, I don't really think it should matter. And most of the time you're home with your baby by the evening. And this is going to have some variables too. There's going to be some moms that are like, no, I work night shift, but just for a normal day work type scenario, you're providing daytime milk. I don't think you should make yourself crazy writing the time on it. And once you're home with baby, you're providing their nighttime milk, which has a slightly higher level of melatonin to help them sleep, and a little bit more fat than the rest of the day. And that's to help them sleep. So if it makes you happy, if you're super type A and you just like labeling everything down to the T and then providing just that right amount to that, whatever makes you happy, is it necessary? No.
Okay. Thank you for answering that. See, I still have questions and I'm not even nursing anymore. Oh gosh. Well, this was great. Let's do one more question and then we will, because actually I have 9% left of my battery life, but let's do one more. And obviously we have a lot to talk about for next week still too, but let me see. You said pump first thing in the morning. Can you then feed the baby right after pumping in the morning? Yes. Or how much time should there be before feeding and pumping?
That gets asked a lot. And here's a couple things. Number one, even the best pump on the market will only get 40 to 60% of your breast milk capacity, which means there's more where that came from. You're not empty. You're never empty. If you're a lactating mother, your breasts are never empty, even if you've just fed or even if you've just pumped. So your baby, number one, is going to be able to get what that pump could not, because it's a much better pump. It's like a 10-star pump and they only make 5-star pumps. Okay. Your baby is the best pump on the market and you made it. You should get royalties for that. I'm kidding. They can absolutely feed if you've just pumped. And I think it's actually a better order to do that is pump first and then offer to feed your baby, because number one, the glands, the villi that have already expressed milk are already sending the signal to replenish. So they're already filling back up with milk. And then you have this really great pump called your baby that's attached and feeding well and pulling out, their feeding for that morning. So I think totally fine, totally doable. And many do that in that order. So pump first, feed your baby, and go on to work or whatever your day looks like.
Yeah. Well, this was great. Thank you so much for a lot of good questions. And I would say, like we do every week, feel free to continue to ask the questions and you'll go back in tomorrow and answer them. And if you have any direct questions, you can always send a direct message to the breastfeeding shop. But Ashley from Motif Medical, thank you so much. I really appreciate you guys partnering with the breastfeeding shop. And, you guys are great at supporting us and supporting the moms out there. So I appreciate that.
It's my pleasure. Thank you for having this platform. And it was so fun chatting with you all. I'm so glad that so many great questions came rolling in today. It makes me excited and I feel useful again during this time. So thank you for that.
Well, take care. Enjoy this nice day. You guys don't have the tornadoes anymore. So
no, it's thankfully moved on. Gosh, it was bad.
Take care of yourself.
You too. Thank you. Bye.